Hi, my name is Kale Evans. I'm a student nurse at Wilson State College, and today I'll be performing the skills of preparing and administering medications. So the first thing I'm going to do is I'm going to perform hand hygiene before entering the medroom. And then when entering the medroom, I'll have my MAR and my provider orders with me. And the first thing I'm going to do with those two pieces of paper is match the patient name as well as all that information to both pieces of paper. So I have Shirley Coast, 54-year-old female, on the MAR, and that matches on the provider orders Shirley Coast, 54-year-old female. Her date of birth is 5/14/1964 on the MAR, and the healthcare provider order is 5/14/1964. So I know that these are the correct piece of paper to match each other. So I can then go on to matching both pieces of paper to the medications that are on them. So the first medication on the MAR is the Refresh Plus lubricant eye drops, 1 drop per eye, 3 times a day, and that is also the first medication on the provider orders is Refresh Plus lubricant eye drops, 1 drop a day for 3 times a day. And I can then move on to the next medication, which is a fentanyl 50 microgram per hour transdermal patch twice a day. And that is on here as well, fentanyl 15 micrograms per hour transdermal patch twice a day. Next is the Augmentin, which is a script that is just starting, and I can look. So she has a diagnosis of pneumonia, and I know that that's what that medication is for. So 600 milligrams by mouth twice a day for 7 days, and it started, it looks like yesterday, so she should still be getting that. So, and yet that matches all on the provider order, 600 milligrams by mouth twice a day for 7 days. Next is the ibuprofen, 800 milligrams by mouth every 8 hours as needed for pain, and that matches. And before preparing these medications, I did do a vital set on the patient in her room, and she was complaining of leg pain, so I know that I'm going to be preparing that ibuprofen as needed for her as she is requesting it. The last time it was administered was at 0:05 last night, so administering it now at 0900 will suffice to the every 8 hours on it. And so the next medication on the list is digoxin, 250 micrograms by mouth daily, and that's on here, and that's for her heart. And I know that I'm gonna have to check her heart rate before administering that. And lastly on the list is Paxil, 20 milligrams by mouth daily, and there it is on the provider orders, 20 milligrams daily, and I know that's for her anxiety. So that'll conclude the provider order sheet, so I no longer need that. And then, so now I can go on to actually preparing her medications. So the first thing I'm going to do is I'm going to match her MAR to her medication bin. So Shirley Coast, 54-year-old female, and that matches the bin, and date of birth 5/14/1964, so that also matches. So I know I have her bin here, so then I can start checking off my first check off of her medications. So starting at the top is her Refresh Plus lubricant eye drops, and that's both eyes 3 times a day, so that's for dry eyes, and that's right here, Refresh Plus lubricant eye drops. So I can get that out and ready. Next is a fentanyl 15 microgram per hour transdermal patch twice a day, and there it is, transdermal patch of fentanyl 50 micrograms per hour. So I know I have that. Next is the Augmentin, 600 milligrams by mouth twice a day, and that must be right here. So the Augmentin, okay, and that's at how much? 600 milligrams, and this is in milliliters, and so it gives me a conversion factor of 400 milligrams is 5 milliliters, and through using dimensional analysis, I know that I'll have to administer 7.5 mils of Augmentin to match the 600 milligrams. Next is that ibuprofen, 800 milligrams, And right here's that ibuprofen. These are 400 milligram tabs, so I know I'm gonna have to give 2 of those. Next is that digoxin, which is 250 micrograms, which is right here. And this is 0.25 milligrams. And convert that to 250 micrograms through dimensional analysis. I know that that's correct. So lastly is that Paxil. So Paxil 20 milligrams. Okay, that must be this one then. So yeah, 20 milligrams of Paxil. So there it is. So that would conclude my first medication check. Now with my next one, I will put that onto the tray, which I'm going to be taking to the patient's room as well. So I will then put on gloves, because now I could have contact with medication when I'm preparing them, and I don't want to put, I don't want to be touching them, especially if, as they're going to be administered orally. So again, starting at the top, we have Refresh Plus Lubricant Eye Drops. And so I'll just need one of these, and that will be okay for both eyes. There's enough in there for 1 drop per eye. And then I'll just place that back into her bin. Next is that fentanyl, 15 micrograms per hour transdermal patch for twice a day. And that's what this is, so I'll just put that there. And I know I'm going to be needing a alcohol pad for that. Next is the Augmentin, 600 milligrams. And again, with my dimensional analysis, I know that I'm going to have to pour out 7.5 mils. And when doing so, I'll make sure to have gloves on and to cover the label completely when I pour it. And I'll pour it at eye level to 7.5 mils, and making sure that the meniscus is right at the bottom of 7.5. So I'm finished with that. I'll make sure it's on tight, and I'll return it back to the patient's bin and put that onto the medication tray. Next is that ibuprofen that she was complaining of pain for. So that's 800 milligrams, and these are 400 milligram tabs, so I'll get out a cup for that. And I'll need 2 of these. And I'll have this one in a separate pill container, or pill cup, in case she has changed her mind about wanting it. So I got those 2 in there. And then I can replace that. Again, those were 400 milligrams, and she calls for 800 milligrams, so I'll need 2 of those. Next is that digoxin. So I'll need a separate pill cup for that as well, because I'm gonna have to check her heart rate before I go in, so before I administer it. So 0.25 milligrams is 250 micrograms through dimensional analysis. I know that's correct. So this can then go into this pill cup. And lastly is that Paxil. So her Paxil is 20 milligrams, which is what this one says. And since they're on their own, I'm gonna have to put this one in there in its own as well. So I have the Paxil 20 milligrams, which is for her anxiety. And so that concludes the second check of her meds. So I'm able to deglove, and I can now leave the med room and enter the patient's room. So I'll make sure to bring a water cup with me in case there's not one in the patient's room already. And bringing my MAR and the medication tray with me, I will enter the patient's room. I'll knock before entering. And then once I get into the patient's room, I'll need to verify 2 different identifications. So I can verbally ask the patient their name. Hi Shirley, I'm Kale. I'm going to be your nurse today. I'm going to be giving you your meds. So could I just get you to verify your name and date of birth, please? And so she's going to tell me that her name is Shirley Coast and her date of birth is 5/14/1964. I can also verify that with her identification wristband, which is Shirley Coast 54 female, with date of birth 5/14/1964. Oh, I see you have an allergy band. Could you tell me what you're allergic to? Promethazine and codeine. Okay, and that's what it says on the allergy band, and that matches my MAR as well. I'm just going to sit you up in bed so you can take your medications easier. Is that alright? Okay. So once she's sat up and ready to take her medications, I'll run through my third check. So with putting on gloves, I can start at the beginning again. And so the first one we're going to be doing today, Shirley, is your eye drops, for your dry eyes. So is it alright if we do that one first? Yeah? Okay. Okay, so with new gloves on, I'll get a rag and I'll wet it, and I'll just clean her eyes really quick in case there's any dirt or anything in the way. If it feels a little crummy or something, and then I'll discard that into the dirty laundry, and then I will get a new pair of gloves and get her medication. And so I'll check this. So this is the Refresh Plus Lubricant Eye Drops, and that matches. And so we're just going to do one drop in both eyes. And so I'm going to pop the top, and I'm just going to pull down on the bottom of the eyelid to create a sac and drop in one eye drop, and I'll have her close her eye, and I'll also give her a tissue in case she needs it to wipe away anything extra, and then I'll do the same on the other side. I'll do one drop after pulling down the eyelid to create a sac, and I'll have her close her eye, and then with her tissue she can wipe away any excess, and then I can throw that back on my tray to be discarded later. Next, I'm gonna put on a new set of gloves, and we're gonna move on to the fentanyl patch. And it says that the old nurse put it on the left side, so I'm just gonna make sure to check that, and I'm gonna have an alcohol swab ready. Just gonna have you sit up, Shirley. All right? Okay. So I'm gonna have her sit up. And yeah, there's that old patch on the left side, so I'm just going to peel that off and fold it in onto itself. And put it over here. And then I'm just going to wipe the area of the old medication, where the old medication was, to make sure that, to where the old patch was, to make sure I got all the excess medication off. So once I wipe down, I'll lay the patient back in bed, and I can discard of that. And I'll get new gloves on because I touched that old patch, and I'll sign off on that the eye drops as I administered it. And then I'll get this next patch ready for administration. So I'll make sure to check it. The fentanyl transdermal patch, 50 micrograms per hour, and that matches my MAR. So I know I got the right one, and so I'll be able to tear it open and prepare it. So once I get it open, I'll pull it out, and 50 micrograms per hour just to make sure. And I'll look what side opens, and then I'll write on the opposite side the date of when I'm administering it, so 9/23. And then I'll initial, and I'll write the time, so 0900. And then since the old patch was on the upper left side, I'm gonna swap sides, and put this new patch on the upper right side. So could you sit up again for me, Shirley? Thank you. And so I'll just peel these off and administer it to the upper right side. And before administering it, I can also ask the patient if they have trouble sticking to the to the patient's skin, and if they do, I could also wipe down her skin with alcohol swab too. And so after I done that, I can put that back on my tray, and I'd get new gloves in case I have any of that medication on me. And then I'd sign off on that medication, as well as I would write down what site it's in. So I put it on the right upper back, so that'd be site A. Okay, so next is gonna be your Augmentin, it looks like. So that is for, yeah, that's for your pneumonia. 600 milligrams, and that was the one that I had to use my dimensional analysis to make sure it was 7.5 milliliters, and that's right here. So with new gloves on, I'll be able to give that to the patient. So here's your medication, and then here's some water to help wash it down. Okay, and so then I can sign off on that one for the 0900. And then next is going to be all of her pills. So I can ask the patient if she wants to take all of her pills together. So Shirley, would you like to take your medications all in one go today? Yeah? Okay. So we're going to run through it. So I've got your ibuprofen. And that's for your leg pain that you told me about earlier. Is it still hurting? Yeah? On a scale of 0 to 10, how bad is it? Oh, it's about a 7. Okay. Does anything help relieve the pain, or does anything make it worse? Just kind of sitting in a, okay. Does it radiate? Is it a sharp pain, dull pain? It's kind of a dull throb. Okay. So I'll make note of that. And then next I'll go and we're going to be giving you your digoxin, which is, yeah, it's for your heart. So I'm going to have to get a listen to you just to make sure your heart rate's good. And I'll just unbutton your top button here so I can get in and get a good reading. And so I'll listen for 30 seconds, but in a clinical setting, I would listen for a full minute for her heart rate. And after 30 seconds, I can then clip her back up. And 30 seconds, she was at 40 beats per minute, or 40 beats, so multiply that by 2, she's at 80, so she's able to get her digoxin. And so her next one is going to be her Paxil, which is 20 milligrams, yeah, for anxiety. Okay, so we got all those ready, so I'll get new gloves on, and now I'm ready to start putting them all into the same cup. And so the 2 pills here is my ibuprofen 800 milligrams, and those are 2 400 milligrams, so I got those ready. Next is that digoxin, which is right here, 0.25 milligrams, and that is equal to 215 micrograms. So I'll just tear that open, and I'll drop that into the pill cup. Maybe. And then lastly, I have that Paxil, which must be this one. And yep, there it is for 20 milligrams. And so I'll just tear that open and drop that in. And then that would conclude my last med check, my 3rd one. And so then I'd be able to administer it to the patient. So I'd give her pills, and she'd be able to put them in, and then she'd drink it with some water, put them down with some water. And then I'd sign off on those ones that I just dispensed. And I'd write the time on them if needed. Okay, and that's everything there. And so once I've finished with that, I would deglove for the last time. I would do hand hygiene. I'd make sure the patient's sitting comfortably. I'd lower them back down to the ground so that they're not of a fall risk. Shirley, I'm gonna come in about 30 minutes to max an hour to make sure that ibuprofen's working on your leg pain. Does that sound good? Okay, so I'll see you then. Before leaving the patient's room, I'll clean up my mess. I will clean up any hazards that might be a risk, and take anything that I brought with me. I would take any dirty laundry that might be there. And then I'd go back to the nurse's station and I would document all the medications that have been administered as well as any that I did not administer. And I would also give the reasonings for why I did not give them. And that concludes my video.